Up, up, up. Is the price of meat going up so fast it's breaking the law? Charges a former state lawmaker stole money meant to help businesses struggling to survive the pandemic. And more people sick, hospitals begging for help, but still no masking required this time around in one of the state's biggest counties. That's what we're talking about right now on Kansas Week. This is Kansas Week, and I'm your host, Pilar Pedraza. We begin with the federal grand jury indictment this week of former state lawmaker Michael Capps from Wichita. He now faces multiple charges. He defrauded the government out of more than $450,000. According to the indictment, the jury charges Capps submitted false and fraudulent documents on behalf of two companies he owns, Midwest Business Groups LLC and Privacy LLC, as well as the Fourth and Long Foundation, of which he is a member, to the Small Business Administration, trying to get economic injury disaster or EIDL loans. The indictment says he also turned in false papers to the Kansas Department of Commerce for small business working capital grants and to Sedgwick County for a Sedgwick County CARES grant, as well as to Emprise Bank in an effort to get a payroll protection program loan. The indictment filed against Capps charges him with a total of 19 counts. The investigating agencies are the FBI and the Sedgwick County District Attorney's Office. Assistant U.S. Attorney Alan Metzger is prosecuting the case. And here to take a look at what this all means, we have Chance Swaim from the Wichita Eagle on set with me. And joining us by Zoom, Dr. Michael Smith from Emporia State University. Welcome to you both. And Michael, since we've got you up, I will start with you. As we look at this case, it's just one of many that we've heard rumors about businesses defrauding the government out of money that other businesses needed because of the opportunity this pandemic presented. Of course, in this case, we know it's just charges, but the rumors abound.
Well, they do. You know, anytime a government or really a private business, for that matter, spends a lot of money in a short time, that accountability and follow-up can be very, very complicated. And if you think, for example, about the unemployment fraud that happened last year, anytime you've got a lot of money flowing, even if it's with the absolute best of intentions, things can go awry. And I'm actually quite impressed that it appears to have been caught.
Very much. We definitely have at least one case here. And Chance, as we look at that here in Sedgwick County, we've been hearing some pretty strong words. It really does feel like they're taking these rumors, these accusations seriously. A lot of investigation going on. My understanding is even with the Department of Labor cases, very similar situation, that the U.S. Attorney's Office has actually developed an entirely separate unit for all of this.
Yeah, you saw something kind of similar during the TARP funding back in the wake of the financial crash in 2008, and the thing on this one that's, look, I investigated this Capps stuff back in December, and one of the things that was really shocking to me was the Inspector General report for the Small Business Administration found, billions of potentially fraudulent loans and grants that were given out. One of the major things is self-certification, right? So you're basically just, here's the piece of paper, you have to take it at face value. The banks aren't on the hook for the money they loan out, and the government's given that authority to the banks. So there's like a lot of layers where malfeasance could take root, and they're reeling, trying to catch as much of this as they can. But there's just so much that I don't know how they're going to be able to recoup all the money that's probably been fraudulently taken. So.
And we've heard with the Department of Labor, they're talking $600-700 million they already defrauded out because of the extra unemployment benefits, and who knows how big this one ended up being. No, it's there's a lot of really sophisticated sort of schemes out there where people setting up shell companies and pretending to be a farm on the beach in New Jersey, things like that just seem ridiculous. Those are the ones that seem to get caught, but if they were a little more sophisticated, you wonder if they would have even raised any red flags in the first place. With the Department of Labor, all the hacking and the outdated infrastructure that was attacked there, it's
it's kind of a bad situation that was tested completely, and we'll see exactly how bad it got. But there's no doubt that there was some illegal activity.
And Michael, as we discuss all of this, you know, we've got an issue where prosecutors are really taking this very seriously. But a big question is, does this entire situation feed into the fuel of those who say that we shouldn't have been adding or providing this extra aid to anybody because Kansans, Americans should be able to stand on their own 2 feet? That is a very dominant attitude in this country.
It is a very dominant attitude, and we definitely see it in Kansas. But to take the other side, I would point out, so often when things like this happen, we'll have people, just like you said, Pilar, that will say, look, the system failed. The money went someplace it wasn't supposed to go. Well, did it? Because the person got caught. And so often, apparently, again, no one's been convicted yet, but somebody thinks something's awry. And so often when the system works and fraud or alleged fraud gets caught, we say, well, clearly this program's a failure. But we political scientists will often say, well, it's inevitable people will try to scam the system. If they're getting caught, I would say the system is working.
All right. And one last note here, Chance, you and I have covered city, county, state government for quite some time now, and this is not the first time that Michael Capps' name has been in headlines associated with negative stories like this. He's been involved with a couple of other major scandals. Yeah.
No, actually two of the entities here involved in this case were also involved in the smear video against current Wichita Mayor Brandon Whipple. Privacy was used to set up a website called Protect Wichita Girls, where it was supposed to be launched from, and then Fourth and Long was used to funnel money for the campaign. And it's supposed to be a 501c3 charity, which is a violation of tax code. So there was a long line of things happening up to this point that probably drew more attention to these entities than just maybe some company that was out there that wasn't owned by a lawmaker or something like that. So it's really hard to say what else is out there. That took, a month to uncover all the different webs that were woven there. And there was kind of a lack of transparency on the Small Business Administration side. A lot of news organizations had to sue to get that information over the summer, and they were successful. So we wouldn't have a lot of this info as the public without that. So I just want to give some credit to the Post, the Times, ProPublica, Wall Street Journal. They all teamed up, and it was good. Yeah.
All right. Well, this is definitely a case that we're going to keep following, and I'm sure it's not the last time we're going to talk about it on the show. So we're going to talk about some other things now. Across Kansas, the number of new COVID-19 cases continues to rise. The state of Kansas adding 4,302 new cases since Wednesday. In the last week, Sedgwick County has reported 1,628 new cases. That is the most since the peak pandemic months of November and December. But calls for a renewed mask mandate haven't gone anywhere in Sedgwick County. The rise in cases has Sedgwick County hospitals filling with patients and the county's health officer calling for a mask mandate for the second time in as many weeks.
I think it is time to seriously consider reinstituting the mask mandate. I think that is the least impactful upon employment, the least impactful on people being out of work, and it is the least measure that really inhibits people's activities.
Ascension Via Christi and Wesley Medical Center say they're treating almost 200 COVID-19 patients for the first time since January. 73 of those patients are in the ICU. Dr. Min says 90% of those patients unvaccinated. He also says Wichita hospitals are having to turn down patient referrals from other hospitals at a time when just 27% of ICU beds are still available statewide. But the county commission decided not to take up the mask mandate. Some members say that's part of the problem.
If you get in a wreck and you need an ICU bed, you might not have one. And that's the reality of what we're facing right now. And it's kind of mind-blowing to me that has been going on for so many weeks. We have heard this for so many weeks. We have not done anything. And we wonder why it's continuing to get worse.
Dr. Min says without things changing, he fears the current rise in cases could hurt the local economy. as it did last year. And Chance, this is something we've been covering here locally. What do you see behind this decision, the things that we've seen leading up to this point? I mean, there are a lot of different factors going on here.
Yeah. No, there's a majority of the Sedgwick County commissioners who do not want to institute a mask mandate, and they have their different reasons for doing so. It's been such a contentious issue locally and nationally. I think there's not a lot of political will to do so. Some they've like Jim Howe, for instance, has been consistently pro mask, pro vaccinations, but pro personal choice in the small government. The government should not be mandating these things, but you should do it just to be a good citizen. And then you have Pete Meitzer and David Dennis, who they've kind of waffled on the issue a little bit throughout the pandemic. At first, I think they were a little more ready for it, but now I think there's a strong. David Dennis really wants people to get vaccinated. He thinks that is the thing that needs to happen, not mask mandates, because the vaccine is the tool we have that's free, available. So there's a lot of competing ideas on that commission as to what we should do. And Dr. Menz, the local health officer, obviously thinks masks should be the next step because we have such a low vaccination rate. We had the lowest of the top 5 in the counties in the state by population. I don't know why that is. I don't know what else the county could do to get more people interested in taking it, but there doesn't seem to be the political will on the commission to require masks. So it kind of puts local school boards, businesses kind of on their own as far as instituting any mandates, and some don't like that. Some don't like being put in that position, and I can understand that. And I think the commission kind of feels the same way too, right? They don't want to be in the position to have to make this decision that everyone has to wear a certain thing, which all goes back to the legislature. Yeah. So it's tough. Yeah.
Well, we all saw the blowback when the governor made the original mask mandate, the protests, et cetera. So, Michael, is it really any surprise that there is a lack of political will for this? I mean, we have seen school board members saying, I'm going to quit because of all of this. We've seen death threats against elected officials. It has become a very volatile situation.
You know, there's something you haven't mentioned yet, Pilar, and that is that tomorrow is the 20th anniversary of the September 11th attacks. And when we reflect on how many times more Americans have died of COVID than died in the 9/11 attacks, I was just looking it up. It's like a 9/11 every 2 days, the deaths from COVID. And it says so much about human psychology that when there's not a clearly identifiable enemy, or when that enemy is not a foreign person. Of course, there's been some attempt with that. Certainly former President Trump tried to make it about China. And of all things, the Biden administration is looking into some of the allegations about China. Although, to be clear, those allegations are about an accidental leak that may have aggravated something that might have happened anyway. They're not about anything deliberate. But nevertheless, I think that it will be the work of a generation of scholars to figure out why an absolutely horrific day of attacks that killed a little over 3,000 people was treated one way, and a pandemic that's killed millions globally on hundreds of thousands in the United States is treated so differently. But in terms of what you said, Pilar, you're absolutely right. Generally speaking, there are a few exceptions, very few in Kansas, but Ohio Governor Mike DeWine would be an exception. But generally speaking, Republicans are much more resistant to vaccine and mask mandates. And typically, if there isn't a mandate, a lot of people don't do it. It's not just about government control. Without a mandate, most people don't do it. So I don't buy that government control thing, because when you're in a community without a mandate, you don't see many people wearing masks.
Yeah, and we have seen that time and time again across Kansas. Meanwhile, a plan to help hospitals in Kansas retain frontline workers and nurses to fight the pandemic has hit a snag. State Republicans hit pause this week on a plan to give up to $50 million to hospitals, expressing concern over how the money would be spent. Republican Senate President Ty Masterson says he wants to exclude hospitals that require employees to be vaccinated. That includes some of the state's largest providers, such as Ascension Via Christi and KU Health Systems. Currently, hospitals across the state are reporting staffing shortages, with open positions for 400 traveling nurses. Many hospitals, like Hutchinson, are also operating at a limited capacity because they don't have enough workers to staff all their beds. Olathe Republican and Kansas House Speaker Ron Reichman says hospitals should be able to use the funds for other issues instead, like mental health. Because of these objections, the Bipartisan Pandemic Response Advisory Task Force delayed approving the governor's proposal. The task force expects to meet again by early next week to consider a revised version of the plan. It has to sign off on the details before the funds could be spent. And Michael, this takes us right back to some of what you were talking about, that political divide, although perhaps one that's not going to stick around as long as the mask issue, because I think everybody agrees we need those nurses. It's just a matter of how we get there.
You know, there's some great political science in this worth studying. Political conservatives have for a generation now said they're opposed to government spending, and they're especially opposed to federal government spending. But at the same time, the question is, if there's money on the table, do you walk away? And that's a big issue with Medicaid expansion, for example, which Kansas has not done. There are hundreds of millions, even billions on the table with this COVID relief money. But at the same time, it comes with strings attached. And, can you just walk away from that money, let it go to another state? I think we see a lot of more conservative Kansas lawmakers that they're not willing to just leave that money on the table or send it to another state. So instead, what they do is they wrangle over the strings attached, and they say, well, we want more of a block grant approach. Give the administrators or us more discretion over how to spend it instead. It's sort of a way to thread the needle between leaving the money on the table on the one hand, or just doing it the federal government's way on the other. And that's what they're looking for because, hey, at the end of the day, they're politicians.
And that money that they don't want to leave on the table is Kansas taxpayer money. And for weeks now, Chance, we've been hearing about how desperately hospitals, Hutchinson has been most vocal about it, I think, need these nurses, but Via Christi, Wesley as well, talked a lot about it. Is there any feel for how much longer they can go without getting some backup?
Oh man, I've heard differing accounts from nurses around, from doctors, from hospital leaders. There's one thing's for sure, they're feeling very, very taxed. They're very much in a day-to-day bubble, to where like they're just trying to get through their extremely long shifts. And if it does continue, like there's just a limit to what people can do, right? We see it in all sorts of different public service jobs right now as well, with staffing shortages, where if you don't have the workforce, that essential service, like a hospital, is going to diminish. The quality of care is going to go down. The number of beds available that can be staffed is going to go down. Especially when we have these different kind of bidding wars for traveling nurses. And it puts states sort of like Kansas, which are more reluctant to compete for these federal dollars because of the strings attached, sometimes, that we sometimes shoot ourselves in the foot and before a foot race with other states that are competing for the same crop of workers. So this would be and could be one way they could go after that, but there has to be the political will for it, and there are other states that are ahead of the game that have already approved this kind of spending and are out there actively recruiting nurses, and that's going to drive up the price we have to pay. So it's a time and money battle, and Kansas typically does not do incredibly well just doing that without having a bit of a political fight.
Yeah, and we do know that some of this loss is because of that exhaustion you talk about, and that's why we have, to a certain extent, fewer nurses now. That's what several hospital administrators have told me. And Michael, I know also KU Health Med has talked about the same thing that Central County Commissioner Sarah Lopez talked about, where they're reaching the point where they're going to have to start making some very painful decisions about who gets treatment and who doesn't.
That's a really good point. There's also some urban-rural dynamic here.
Drop the power grid.
So, for example, in many places, urban and suburban places, there's a higher vaccination rate and more willingness to wear masks. Johnson County has one of the highest vaccination rates in Kansas. Wyandotte County isn't as high, but it's higher than many places in rural county. That's where KU Med is. And so here you have folks coming from unvaccinated communities, unmasked communities into the cities saying, we want health care. And there's some pressure there. Another point I want to point out is all this debate, all this politicization of COVID, we forget about what that does to the morale of our healthcare workers. And we may see more and more people saying, I don't care to continue in this profession. It's not fulfilling anymore because of the way we treat our healthcare workers.
Yeah, I've definitely spoken with folks involved with some local healthcare facilities who do feel very beaten up on and starting to get very defensive. And they, again, reaching that point you're talking about of just saying, is this really worth it anymore? So firsthand accounts of what you're talking about there. All right, one other thing to talk about here today. If you've noticed a rise in meat prices at the grocery store, you're not alone. What could that have to do with a pandemic?
Grocery prices are up nearly 3% in the last year, but beef and pork are up more than 10%. Some people are blaming big meat companies such as Tyson, Cargill, JBS, and national beef packing companies, saying it doesn't add up.
A lot of them is price gouging. So from like March, April of this year, ribeyes were maybe $10 range, and now our cost is almost $18 a range.
From farmers to consumers, this impact ripples all the way down the chain. Local Yoder Meats manager Pat Hertel says it's an alarming trend that's hurting his company.
We've seen quite a bit because we do buy in some of our boxed products, and we see it's 10-15% increase in our cost.
The ribeye is one of the cuts Yoder Meats is seeing the highest inflation in. Typically, you could get a pound for about $13. Now it's climbing to nearly $20, and they're barely breaking even.
There's never been this big a disparity between the price of cattle at the stockyards or at the packer and at the grocery store.
Farmer Larry Steckline worries about cattlemen across the country.
When his cattle are ready, they got to go. And when they bid him this much money today, take it or leave it.
Back at Yoder, even weekly specials on hold.
We always do daily specials, try to draw people in. We can't really do that because if we did $1 off, we'd have to raise our prices even more.
And Hertel says it's only going to get worse.
Holidays are right around the corner, and it's a big beef holiday, so I think we're all going to pay the price.
In Wichita, Morgan Mobley, Cake News on your side.
And while agriculture makes up probably the largest portion of the Kansas economy, Kansas not immune, as Morgan just showed us. Former state representative Don Heineman tweeting out this week a picture of a warning in Wendy's in Scott City that they were only serving single patty burgers because they couldn't get their hands on more meat. So even the big companies are having trouble getting hold of it, not just your local grocery store.
Yeah. No, it's a big deal. We have a lot of we've built our society around a lot of beef consumption, and the state of Kansas is a big beef producer. And one comment there that kind of resonated and it kind of opened some questions in my mind is, he talked about the difference between the price at the stockyard versus the price at the grocery store or the restaurant or whatever. It makes me wonder what's going on. Is it the brokers? Where is the gouge? What, and at what point is it too high for people to pay for, and then you're throwing out meat every night that's wasted. So it's a big deal, and you notice lots of shortages if you go out to eat, not just with beef, but styrofoam cups with all sorts of things. So there's all these markets that are kind of struggling right now.
Yeah, and that is one good question. Michael, how much of this really seems to be, and I know this is more economy than politics, but how much of this seems to be price gouging, and maybe how much a part of the lack of workers in the delivery sector of our economy?
You're right. We need to ask an agricultural economist about that. In general, one thing I do know is that this is an industry hit very, very hard by the virus. I know your viewers are tired of hearing about COVID. I'm tired of talking about it. But we have a facility here in Emporia, and those workers work in poorly ventilated areas, indoors, very crowded, with blood and things that come from animals. Injury rates very high. Open wounds can get infected easily. They're basically hot spots for COVID. And I have no doubt that the combination of workers who are unable to work or people just not wanting to do that if they can support themselves by some other job is probably a factor. But the allegations, including from the Biden administration, are that the meat industry, which is dominated by just 4 producers, is using that as a pretext to raise the prices even higher than what it takes to recoup their costs. We'll have to see how this plays out.
Yeah, and we do know, talking about the meatpacking plant workers, the government just this week making a $600 bonus for them to help cover some of their costs as they bought their own personal protective equipment and stayed home. And the union saying that's a drop in the bucket. They need more.
Which is very believable to me. The meatpacking industry employs a lot of immigrants, including undocumented immigrants. It's work. I know a lot of people who do it because of the facility here in Emporia, my students' parents and so forth. It's extremely hard work. It's temperature extremes. Frankly, it's work that a lot of people would rather not do. That's one of those industries where it's great for politicians to attack undocumented immigrants, but if they weren't here, that work probably wouldn't get done.
All right. Thank you so much, Michael and Chance, for joining us. We are out of time. I'd also like to thank our news partners at Cake News, KSN News, and the Wichita Eagle for sharing their materials with us. For now, stay safe and have a great week.